Namaste. My name is Oman Kumar Somavarthu, registration number 40118097, Jan 2018, NHB batch, NHB yoga batch. As part of my fourth semester dissertation, I selected Niyantrita Paripuroga Bharat. My thanks to my research guide, Manish Pandey, and my NSC coordinator, Pramila Chaudhary. Introduction about my dissertation. It's hypertension and cardiac coronary artery disease. Hypertension is a global epidemic. Hypertension is defined as the presence of the blood pressure elevation to a level that places the patient at an increased risk for uncontrolled and prolonged elevation of blood pressure can lead to a variety of changes in the myocardial structure, coronary vasculature, and the conduction system of the heart. The cause of hypertensive heart disease is chronically elevated blood. According to the Flemington study, hypertension accounts for about one quarter of heart disease. Community-based studies have demonstrated that hypertension may contribute to the development of heart failure in as many as 50 to 60% of patients. The prime cause of coronary artery disease is modern lifestyle and urbanization and several risk factors such as dyslipidemia, hypoglycemia, triglyceride, and hypertension. Yoga reduces cardiac risk factors and improve engine stability, blood glucose level, cholesterol, and triglycerides, blood pressure, and also helps in stress management and improvement in health-related quality of life. With meditation, the level of stress hormones reduce the risk, further help to reduce stress levels and improve cardiac health and glucose control. The references from the ancient literature. The Bhagavad Gita. In Bhagavad Gita, the Lord Krishna has mentioned the root cause of all these miseries. From the second chapter, from sixth to second stanza. ध्यायतो विषयान् पुंसः सङ्गस्तेजोपजायते सङ्गात् सञ्जायते कामः कामात् क्रोधोऽभिजायते. When a man thinks of the objects, material things, its attachment of them arises. From attachment, the desire is born. From desire, anger arises. And the desire is fulfilled. And what are the consequences of this anger? The next stanza, the Lord Krishna mentioned the sequence of the things from the anger. Krodhat bhavati sammohah, sammohah smritividhamah, smritividham chat buddhinasho, buddhinashat pranashyati. From anger, complete delusion arises, and from delusion, bewilderment of memory. When memory is bewildered, intelligence is lost. When intelligence is lost, one falls down again to the material state. What is the remedy? What is the remedy for this? The Patanjali Maharshi in Patanjali Yoga Sutra mentioned that Ishtan, Ishtan, Shavita Vishaya, Ishtan, Shavita Vishaya Vikrushnasya Vashikaranasyanjana Vairagyam. Detachment is the detachment. Vairagya is achieving perfect mastery over desires for the objects of experience that are seen or heard through the. This is one of the two fundamentals to prevent modifications in the chitta, storehouse of meaning. From the modern science, the scientific literature, the studies have proven that yoga intervention was more effective compared to drug therapy in controlling the systolic blood pressure showed significant reduction in number of anginal episodes per week, improved exercise capacity and diffusion body weight, serum cholesterol, LDL cholesterol, and triglyceride levels also showed greater reduction as compared with control groups. Further studies mention that the study was performed at urban middle-class locations defined according to municipal records in the US. Stratified random sampling using a house-to-house survey was and also among participants without a self-reported cardiac heart diseases and angioplasty stroke diabetes. And the further studies high BMI, hypertension, metabolic syndrome, and abdominal obesity were in the most prevalent CVD risk factors observed in the population. The aim of this research is to prevent and treat hypertension and heart diseases through yoga-based lifestyle change. What is the objective of this study? To estimate 2020 prevalence of hypertension and coronary artery disease in all zones of India, to develop validated common yoga protocols for hypertension and prevention of hypertension and coronary artery disease by risk reduction through yoga-based lifestyle. The last mechanism of the action of yogic management in heart care and the management of coronary heart failure. What is the methodology? In the methodology, the sample study included 40 adults within the age group of 20 to 60 years. And from all the participants included in the study, informed the consent was taken. The data collected was confidential and not disclosed under any circumstances. And then what is the design? The design is the pre-test and post-test design. The group A is a test group, a yoga group, having 20 adults, and the group B control group in non-yoga group, having 20 adults using convenient samples. Yoga module for adults for the prevention of hypertension and heart-related yoga intervention. The intervention. Yoga module for adults to prevent the hypertension is the primary intervention for the experimental group. The second is the control group continued routine physical activities with the normal daily routine. What is the inclusion criteria for this? Participants age group between 20 to 60 years, Indian nationals living in India. Participants should willingly provide online consent prior to the study. Hypertensive subjects within the age range 20 to 60 years with a minimum 1 year history of hypertension. What are the practices for all these intervention participants? The type of activities and the list of practices are given. Prayer. The first one is the prayer. Sahana Vava. The next one is loosening practices. Sukshma Vyayama, slow jogging, side bending. And breathing practices, hand in and out breathing, hand stretch breathing. The asanas, Ardhagati Chakrasana, Paschimottanasana, Pushkrasana, Vajrasana, Bhujangasana, Shalabhasana, and Makarasana. The relaxation techniques, the deep relaxation technique, guided relaxation, and pranayama, nadi shodhana, dhamari, and the sectional breathing. And the meditation, Om meditation, Nadanusandhana, and the closing prayer is Sarve Bhumti. What is the exclusion criteria? Subjects with a history of diabetic mellitus, subjects with any form of psychiatric problem. Patients taking antipsychotic medication, severe heart problems. Those who are diabetic or any other chronic illness other than hypertension and cardiovascular disease. And age less than or more than 60 or the exclusion criteria. The data collection. The study included 40 adults between the age group of 20 to 60. Two groups were made using convenient samples. Group A test group, yoga group with 20 adults. Group B, control group, non-intervention group with 20 studies. Participants were assessed used using perceived stress using PSS before and after completion of the intervention. Risk factor categorization. The profile for hypertension, systolic blood pressure, diastolic blood pressure, and for heart care, LDL, HDL, and right insurance. And out of the list of participants, the categorization is low risk, medium risk, and high risk. The result, there was no significant difference found in pre-intervention comparison between both the groups, hence both groups were comparable to baseline. Post-intervention between group comparison showed a significant improvement in systolic blood pressure in IAVT group compared to non-IAVT group. The results, this is IAVT group having the pre and the post, the percentage of the change and the p value, and non-IAVT group the pre and the post, and the percentage change and the p value. And for the cardiac parameters, triglyceride, LDL, HDL, the parameters has been taken and the mean, median, the control group for the control group and the IAVT group that has been taken, the mean standard deviation just and value calculated. The discussion. The study was done to understand the effectiveness of yoga on can with hypertension. There are many studies show that yoga-based lifestyle has shown significant benefits. It is important to note that most of the study group and control group participants were in the range of 35 to 55. In this age group, the perceived stress was more noted relative to the other groups. When yoga group underwent integrated yoga practices for 1 hour daily, the indicators of psychological stress showed no significant difference in control group with significant difference in yoga group. After 2 weeks of intervention, the stress was again measured using the same tools as in the beginning of the study. The study group, yoga group, showed significant reduction in perceived stress score. Studies have shown gender to be a significant contributor for hypertension. Males have higher blood pressure than females through major part of their life. Most of the epidemiological data report higher prevalence of hypertension among men. Similarly, our study reports a higher prevalence among males with threefold risk to develop hypertension. Apart from gender, age was also found to be associated. A study to age physical inactivity has been found to be associated with hypertension. Intervention studies have also shown that increased physical activity rates blood pressure. Like the present study, many studies have also revealed significant association of physical inactivity with hypertension. Association of physical inactivity with BMI levels and hypertension in this physically active population is a matter of concern. This suggests physical activity being an important predictor of lifestyle disease. The conclusion part for this is present study indicates the positive role of intervention in cardiac parameters among the subjects with essential hypertension. The references, evidence from this direct intraneural recordings, nerve activity in borderline hypertensive humans, a comparative study of the effect of transcendental meditation and shavasana practice on cardiovascular system. There are further studies on the prevalence of hypertension and hypertension risk factors in a rural Indian community. Effect of rosary prayer and yoga mantra on autonomic cardiovascular system. Immediate effect of Sukha Pranayama on cardiovascular variables in patients of hypertension. The effect of blood pressure reduction on cognitive function. Generalized anxiety and major depressive disorders with hypertension in middle age women. Slow breathing improves arterial baroreflex sensitivity and decreases blood pressure. also blood pressure and inflammation in a current places in hypertension. Worldwide appraisal of hypertension. These are all the references that have been proved the IOIT gives positive role to reduce the risk factors in hypertension and coronary artery disease. Thank you. Thank you very much to all.